No age is immune to back pain. About 12% to 26% of children and adolescents suffer from it. Men and women are equally affected. Most lower back pain is acute and will resolve itself with or without treatment. If symptoms persist beyond 3 months, the condition is considered chronic. Most back pain occurs between the ages of 25 and 60. David has just finished national service in Singapore and is waiting to go to university in the United Kingdom. At just 20 years old, he has been diagnosed with disc degeneration.
Actually, I've had issues with my legs since I was a kid, and it's always been a bit hard for me to walk for prolonged periods. But I just, never expected it. I mean, nobody diagnosed it, nobody suspected. Just, one day kind of realized that, hey, there's something wrong. I've had it apparently for 5 years, but before a couple of years ago, I didn't even know that I had it. So basically, one day I just couldn't stand up, and I realized that the condition was getting worse, and I was officially diagnosed with disc degeneration. Well, it's not that bad yet, but I expect it to be much worse when I get older, because I mean, even now it's not exactly easy for me to take a long walk or even jog down anywhere. So physiotherapy has helped, but it's not the most comfortable thing to have in the world. So I kind of miss the days where I could do anything and not really worry about what it's doing to my back.
What seems to be bothering you?
I'm having a few
The
problems.
effectiveness of back pain treatments varies from person to person.
Standing for a long duration, I'm getting radiating pains. Starting
The
from my
doctor
back
will generally begin
and
by
the butt,
asking about
moving down to the
symptoms
bottom
and taking a
of my
medical
arm.
history.
How long have you been having this now?
I've had this for a few years.
This will be followed by a
definitely
physical
more than 5.
examination.
And basically it gets aggravated the longer I stand or the longer I sit still.
When we see these patients, it's important to examine them to see the location of the pain and whether there's any muscle spasms in the area and how much flexibility there is in the joint. So we ask them to bend forward and bend backwards and so on. Now then we also want to examine them neurologically to see whether there's any nerve compromise. And so after examination, we usually would want some radiological investigations. Here we see that to start off with, we usually request for a plain X-ray. And with the plain X-ray, we will be able to see whether there are any degenerative changes to the bone. And also we'll be able to see how big is the gap between the vertebrae. Now then with this, then we'll be able to give some idea as to whether the disc has prolapse or not. But in a lot of the situations, we may not be able to because the plain X-ray would only show the bone structure. So sometimes, if the condition is severe, then we may well need to do a more detailed investigation like an MRI. An MRI will be able to see the soft tissues, including the disc and the nerve. And with this, we will be able to assess to the severity of the prolapse to the disc. When we do an MRI, you can see that the MRI here, that in a normal situation, the disc looks like this, where we see the nucleus annulosus, the annulosus here, and the nucleus pulposus here. Here we see it as a bright spot surrounded by a dark rim capsule here. These are the bones of the vertebra. In this situation here, this disc is diseased in that it is dried. One cannot see the actual bright nucleus pulposus already, and is herniated out. And this results in the disc material protruding out into this canal, resulting in nerve compression here. Now then, some patients may get pain to the buttock area. Sometimes it may be to one side, sometimes it may be to both sides. And again, we see that more MRI pictures of the condition, in that the disc is pressing against the nerve here, and in this situation here the disc material has traveled upwards to almost to the next level. So MRI does play a very significant role into helping us to make the diagnosis and to assess the severity of the problem.
Through physical therapy, David learned habits and principles that helped him to work on strengthening the back, neck and core muscles.
The physiotherapy treatments were mainly focused on, firstly, they were to reduce inflammation. So I had some ultrasound therapy, which basically relaxed the muscle and tried to reduce the inflammation so that the initial symptoms would go away. After that, I went for classes every week, which focused on strengthening my core muscles, which would take some of the weight away from my spine. So it's basically helping me with my posture, and yeah, it's helped a lot. And basically now I can function pretty normally, about the same as before my injury. So things are getting better, but I just hope they won't get worse.